Hi, I'm Iris Feinberg, the Associate Director of the Adult Literacy Research Center at Georgia State University in Atlanta. Our research center focuses on both theory and practice through interdisciplinary research, professional development, and community partnerships to understand the challenges and opportunities for adults with low skills. There couldn't be a more challenging time for all of us than right now. My presentation will share with you 2 actions that we've taken to help improve access to understandable and actionable health information for low-skilled readers. Culture and language play significant roles in understanding and using health information. The onslaught of COVID-19 and coronavirus information, misinformation, and changing information has proven to be especially deadly for people of color, non-native English speakers, and adults with low literacy skills. Any conversation about health and well-being is also a conversation about culture. Culture plays a role in how patient education is perceived, what kinds of compliance measures are likely to be adhered to, and why health promotion interventions may work for some people but not for others. Cultural competence allows us to understand the context a person lives in. But it's also a conversation about language, and by that I mean both the complexity of the English language and the technical language of healthcare. Adults with low literacy skills struggle with reading and comprehension issues, but all of us may struggle with the language of healthcare because it's a second language, and if you're not trained in medicine, you generally have no idea what healthcare providers are talking about, especially if you're anxious, concerned, or are just sitting half naked on an exam table thinking about a million other things. One way to think about culture and language issues is through the lens of health literacy, which is the gap between how people understand health information and how those who provide health information actually deliver it. Yes, it's an emergency. We didn't have enough time to do any audience research, comprehension, or usability testing, or any other method you use to determine that the audience learns, understands, and remembers what you intended them to do. So we called on health literacy principles and plain language guidelines to complete 2 projects. One for adult educators, healthcare providers, and community organizations, and the other for adult learners and non-native English speakers. The folks at IHA were collecting samples of coronavirus and COVID-19 materials. We spent some time looking at them and realized they were written at many different grade reading levels, and it could be difficult to sort through them and figure out which ones would be appropriate for low-skilled readers. We reviewed about 150 pieces of material and found that about 40 of them were appropriate for low-skilled readers. We divided them into easier, reading up to grade 5, and harder, reading grades 6 through 9. We used a variety of tools to measure readability because the materials were in different formats. Those tools were the Dale-Chall Readability Index, Fleisch-Kincaid, and Visible Thread. You might not be familiar with Visible Thread. One of the nice features of the tool is that you can score PDFs, and most of the documents we received were PDFs. Here's a screenshot of our library on our website. Once we established it, we sent a link to community organizations, adult educators, adult literacy organizations, and healthcare organizations. The intended audience for this library is people who work with adult learners and who can use this information to educate them about coronavirus and COVID-19. Here's a link to our website. You can find the library there, and I hope you use the materials. For our second project, for adult learners, was what we call a flip book. I'm fortunate to be a co-investigator on a CDC-funded Prevention Research Center grant run out of our School of Public Health that focuses on a large refugee community about 10 miles outside of Atlanta. Our community partners reached out to us with grave concerns in early March that residents had all kinds of questions and myths and misinformation about the coronavirus and COVID-19. They asked for help in communicating accurate and scientific information in a way that community members could understand. So we created this flip book, or a booklet, that's half the size of a regular letter-size page. It has 16 pages in it. The first half addresses myths, like Black people can't get sick, or if you're from a hot country, you can't get sick. The rest of the booklet addresses prevention strategies, like wearing a mask or social distancing. The booklet reads between the 4th and 5th grade level. I'm going to take a few minutes and walk you through a few pages of the booklet. But before I do, if you'll go to our website, the address is at the bottom of this screen, you can not only see the entire booklet, but you can download it for your use. All right, so here are some of the myths. So we tried to set this up so it was directed towards somebody asking a question and getting an answer. So the myth pages all start with, "This is what I heard." The answers are very simple and very straightforward. We tried very hard to repeat different phrases from page to page. So you'll see on the page that says Black people cannot get it, anyone can get coronavirus, many people have died. This is what I heard. Women can get less sick than men. Again, anyone can get coronavirus, both women and men have died. We're still having some struggles with the home remedies page. People are not quite so sure that garlic and black tea can't cure them. We wanted to help people understand what to do if someone was sick. So we set up these two pages facing each other. The one on the left says, "What should I do if someone in my house is sick?" And the one on the right says, "What should the sick person do if someone in my house is sick?" And you'll see that the answers very much kind of follow each other. And finally, this is a community of folks who work. They're frontline workers, essential workers. They work in poultry plants. They're janitors. They work at grocery stores. And so they needed to know how to wear and clean their face masks, but also how do you clean up when you get home from work? What do you do? And so we provided this information on these pages as well. Because we were working in a refugee community, we printed the booklet in 6 languages as well as English. The booklet was so successful that our County Board of Health asked us to provide them with copies to distribute. We're currently doing knowledge pre- and post-testing to see if we all just like the flipbook or if it really has some legs. Regardless, providing folks with important health information that is at their reading level and in their own language is one of the best ways to promote health behaviors. I'd love to have you visit our website or give me a call. Please use the materials we've created. Thanks for your time today. Stay safe, sane, and well.